Hello there, I'm Dr. Tanvi Vaidya. I'm a consultant dermatologist and medical director of DermaMD clinics in Thane, Mumbai. Today we're going to be talking about tanning. This is a very common concern that a lot of us Indians, people with brown skin tend to have. So let's get started. The first thing we need to do is to differentiate between a tan and pigmentation. So is it a tan or is it just basic pigmentation? Pigmentation would be discrete, there would be a clearly defined patch or at least an ill-defined patch. It wouldn't be all over your face usually. If it's a tan, it's going to be diffuse. It's typically going to happen post sun exposure. There is immediate tanning and there's delayed tanning. Immediate tanning is ASAP. After you go out into the sun, your skin first starts to get a little red and then it tans. Delayed tanning is what sets in later and what's going to last longer. So we need to tackle both elements of tanning. Before we get started on how to tackle tanning, we need to understand why tanning happens. Now tanning is sort of like a defense mechanism of our skins to the sun's UV rays. So every time we are exposed to the sun's UV rays, the melanocytes in our skin, which are the cells that produce melanin, are going to be stimulated into defense mode. They are going to produce more melanin and this helps you prevent your skin from getting burnt. So having melanin in our skin as a defense mechanism is a great thing that a lot of people with lighter skin tones like Caucasians do not have. We should thank our melanin, we should thank our skin's ability to tan because it's protecting us from burns and from skin cancer, which is yay. Irrespective, we still don't like the look of a tan most of the times. I personally really do. I quite love coming back all tan after I go diving or I go swimming. So let's get started with how to prevent a tan. Of course, the biggest thing is staying out of the sun. Mainly avoid excess sun exposure when the UV index is super high. So when you know between 10 a.m. to 4 p.m. is when the UV index is really high, stay out of the sun, stay indoors, stay protected. When you are sun exposed, use physical methods of protection as much as you can. So full sleeved clothing, hats, sunglasses, scarves, whatever you can, especially people who are riding a bike a lot tend to typically really tan on their forearms and their faces. So take care of all of those areas. Of course, other than this, sunscreens. I'm a dermatologist, how could I not talk about sunscreens? So sunscreens are something that will massively help you prevent a tan. Now SPF and your PA rating, these are two things that you need to look out for in your sunscreen. Anything above an SPF of 30, I always keep saying, is pretty much the same. So don't stress too much about SPF 50 hai ki 60 hai ki 80 hai. Honestly, it's all the same above a 30. Just remember, no matter what the SPF, it's going to make a 1% difference post 30. And the main thing is your sunscreen, no matter how long lasting it claims to be, is not going to last you more than 3 to 4 hours. So make sure you're reapplying your sunscreen. That is one of the most important things that we forget to do. Sometimes we remember to reapply on our face, but we don't remember to reapply on our bodies. So make sure you remember to do that. If you're going swimming or if you're sweating a lot, you need a water resistant or a sweat resistant sunscreen. Water resistant means it resists water exposure for 40 minutes. Waterproof is it resists for 80 minutes. So frankly, honestly, nothing is completely waterproof. So remember, every time you're in contact with the water, like you go swimming, you come out of the pool, make sure you're reapplying your sunscreen again. So these are things that you really need to watch out for. Next comes the PA factor. Now, no matter how much we rant on about SPF, PA is actually more important than the SPF. PA is what protects you from UVA radiation, which is the one that actually causes more tanning than UVB, which is what SPF protects you against. So look out for a PA rating. You need a PA of at least 3+. That really makes a lot of difference. Now coming to basically which sunscreen to choose. Now that depends on your skin type. People with oilier skin may want a lighter, gel-based or matte kind of sunscreen. People with drier skin may want a more moisturizing, creamier, heavier sunscreen. People who have a little bit of pigmentation may want a tinted sunscreen to give that blue light protection as well as a slight bit of coverage. So here are some recommendations that I'm going to put up. These are if you have oily acne prone skin. These are if you have dry skin and you want a heavier moisturizing kind of sunscreen. These are if you want a tinted sunscreen. And these are some body spray sunscreen options that you can use if you feel too lazy to actually sit spreading a lotion all over your body. Next, moving on to depigmenting ingredients. Now, how do you get rid of a tan that has already happened? So there's a lot of different depigmenting ingredients that you could use, starting with exfoliants. Now, exfoliants means what? The skin cells that are forming the superficial layers of your skin, you're going to just exfoliate them. So you're going to get rid of them. So when you talk of exfoliants, there are AHAs, BHAs, glycolic acid, mandelic acid, lactic acid, salicylic acid used only if you have really oily skin, of course, retinoids. All of these things are exfoliants that will help get rid of those cells. Second is actual depigmenting ingredients, which are going to slow down the process of formation of melanin. So there are ingredients like kojic acid, arbutin, licorice extracts. All of these slow down the enzyme tyrosinase, which helps in the formation of melanin. So you're going to slow that process down in the first place. Lastly, there are antioxidants like vitamin C or niacinamide, which boost the role of your sunscreen, so it will prevent that much of a tan from setting in the first place. So these are the various options that you can use. Usually what I recommend is using a combination of these ingredients, more antioxidant heavy in the day, more exfoliant heavy at night. The depigmenting ingredients can be a part of both of these routines. Again, I'm going to link some products which we usually recommend to patients who have a tan right here. Again, the link to buy them is also linked right here. I tell you that there's a lot of scams that happen in the name of get rid of your tan, skin whitening creams, skin lightening creams. Don't fall for everything that you see out there in the market. There's a lot, because this market is huge, the demand is huge, and people just want to get you to fall for any product that they want to sell. Soaps, cleansers are frankly not going to help you get rid of a tan because their contact period is not long enough on your skin. So don't rely on a soap, just use a gentle soap, anything is fine. Don't use very harsh scrubs. Using a scrub far too often, though of course that is also exfoliation, but using it once in a week or once in 2 weeks is okay. If you start using it every day, and we see a lot of these cases, you can develop something called frictional melanosis, which is actual pigmentation that happens because of using a scrub. Particularly, we see a lot of patients who develop it here and here because this is where you scrub the most, when you use a loofah or a pumice stone. So definitely avoid those. Another thing to avoid is bleach. Bleach is very irritative. It has a lot of peroxide that's going to go on your skin, and it's going to cause a lot of oxidative stress, and it can really worsen burns. So definitely stay away from bleach. Stay away from baking soda, toothpaste, lemon. I don't know how many different products you will see out there that claim to depigment your skin, but frankly will just irritate already inflamed skin. Steroid creams initially can give you the appearance of slightly brighter, lighter skin, but to be honest, steroids in the long term are going to damage your skin. We see an entity called TSDF, which is topical steroid damaged face. It causes excess hair growth, redness, acne, stretch marks on your skin, and all sorts of things. So please don't fall prey to any of these steroid creams as well. Now, in terms of home remedies, what can you use? Curd contains lactic acid, raw milk also contains lactic acid, so this can be used. If you have a burn, you can consider using aloe vera gel. You can use lactocalamine, which is usually there in most of our homes, to soothe any of those burns. These things will help. Honey can help moisturize dry and inflamed skin. So again, honey can be combined with your curd or with your milk to apply. But the only thing is that these contain very low percentages of lactic acid. So it's going to take a much longer time than it would when you use, say, a 10% lactic acid. What foods should you eat when you're trying to battle a tan? Basically antioxidants. So whether it's dry fruits and nuts, flax seeds, if you eat non-veg, then fish is an excellent source of omega-3 fatty acids, works extremely well. Fruits, vegetables, particularly citrus fruits, really help with a lot of vitamin C in them. Amla contains vitamin C again. So these are all great choices that will give your body that boost of antioxidants, which helps it counter that tanning process a little faster. Lastly, coming to procedures, if you want faster results, you have a function coming up and you really want to get rid of your tan a little quicker, then procedures definitely work. We do basically microdermabrasion, we do chemical peels, we do Nd:YAG laser tonings, which work extremely well. What a microdermabrasion is doing is it's a gentler way of physical exfoliation. What a chemical peel is doing is it's combining exfoliation along with a deeper penetration of these depigmenting ingredients. And lastly, an ND-AG laser is a laser that hits pigment. So it's just hitting the pigment, blasting it off, getting rid of it. So these are the much faster ways of getting rid of it. Would it work in one day? No. I'm sorry. Even with the procedure, it's not going to go away in one day. It takes a little longer, maybe about 2 to 3 sittings of these procedures, which would take approximately a month and a half, and you'd be able to get rid of your tan a little faster. With just creams alone, it might take a little longer than that. With home remedies alone, it might take even longer than that. Would your tan go away on its own without doing anything? Of course it would, so don't worry too much about it. It would go away anyway. Just keep sun protecting in the meanwhile. Another question I get asked a lot is IV glutathione. Would IV glutathione help you get rid of your tan faster? Yes, it would, because it contains glutathione, which is a very strong antioxidant, and it also slows down that tyrosinase enzyme. So it's going to slow down pigment production. The only problem with glutathione, which I would really like you to know, is that it is temporary. Your blood levels do not stay on for too long. So while you're using gluta, you'll see a nice skin brightening immediately while you're using it. The moment you stop using it, that effect is going to fade off. The second thing is, there's a lot of places where they're pushing IV gluta at very high doses. Please be careful of this. You need to make sure that you're fit for taking IV glutathione. There have been cases where there's been an elevation in liver enzymes because of the use of excessively high doses of glutathione. So make sure you're going to a dermatologist who knows what they're doing, and only then go in for procedures like this. I hope this video was useful. Do follow me for more such tips, more educational content about skincare and hair care as well. If you have any questions, please ask me in the comments. If you like this video, give it a thumbs up, and see you next time.